My name's Dr. Gil Lederman, and we're here talking about prostate cancer. We have a very special guest, and very special for many reasons. He's an accomplished journalist and radio talk show host. He's also a philanthropist, and he's also a man who had prostate cancer, and he's honest with his constituents, he's honest with his listeners to tell what really happened about his prostate cancer. And that's what we're here to explore today. What happens to a man at age 55 who had prostate cancer, who chose to have robotic surgery? What happened? And we're going to have his view of what happened to him. And I can tell you, after speaking to him for many, many years, what happened to him happens to most men who have prostate cancer robotic surgery. So we're here to warn you to investigate the options before you might become another victim of prostate radical or robotic surgery. Curtis, good morning.
Well, it's not a good morning because I no longer have my prostate. Boy, was that a mistake.
Well, let's go back to the beginning.
Sure.
You were perfectly fine, and then how did you find out you had a prostate problem?
Well, I was giving a speech in Marlboro, New Jersey, in a green area, and I went to the bathroom afterwards before catching New Jersey Transit back to Penn Station, and all of a sudden, I passed out.
During urination?
Yeah, passed out, hit my head, woke up like 15 minutes later. The staff of the restaurant, "Oh, Curtis, you okay?" And I was real woozy. Took the train back, realized I had a problem, called my primary health care physician, said, "You got to come in on Monday." Came in on Monday, said, "Let's take a PSA." Took a PSA, came back, said, "It's at 3 level. I want to send you for a further test." He goes, "It's going to be a little painful, a little snip. I said, okay, what the proctologist, Yeah, snip. They took the snip.
Did you have pain with the biopsy of the prostate?
A little bit.
Okay, but not too much. Did you have anesthesia with that biopsy?
No.
You did not?
No, I did not.
So I can just say that most men have anesthesia and don't feel a thing. So I see thousands of men with prostate cancer. You got a lot of experiences that my patients tend to avoid.
Yes.
But I just want to make it as a point for the listeners that if you have a little bit of anesthesia, the biopsy takes like a second. It's like a spring-loaded gun.
Yes.
And if you have anesthesia, you don't feel a thing.
Right.
And I'm only saying it because a lot of men don't get prostate biopsies because they're fearful of what happened to you about having pain during a biopsy.
Yep.
And people should not be fearful about pain. If they came to me or I'd hook them up with a doctor, they would not be having pain during biopsy.
No, well, this doctor was old school. There was no anesthesia. He did the snip, and I went, "Ow, ow!"
Wow.
Then about a week later, I get a call right here at WABC. It's right before I go on the show. He goes, "Curtis, are you sitting?" I knew right then wasn't going to be good news. And the fear, fright, hysteria, and hype in his voice was, "You got a serious problem. We have got to get that prostate out." He goes, "I don't do the surgeries, but I'm gonna make a recommendation."
Now this is a urologist who did the biopsy. So urologist is a surgeon whose specialty is cutting on the prostate and related tissues.
Right. He said, "I'm old school. I use the scalpel, but I want you to go to a specialist. They have this newfangled way, robotic surgery. They're in, they're out. And with all the damage you've had before, because they had gunshot wounds," he goes, "I think this would be best for you."
Let's just talk about that for a minute because we're going to come back to that. Now, about 15, 20 years ago, a group of people came after you for your beliefs, and they ambushed you, right?
Yeah, 1992 in the back of a cab in the Lower East Side. Right before I was coming to WABC to do a broadcast in the morning, John Gotti sent his Gambino goons to shoot me. They did in the back of that cab. I got shot with 5 hollow point bullets. I was lucky to escape.
This is at very close range, multiple bullets right into your body, and you ended up in the hospital for a long period of time.
Long period of time, back and forth. Had
And with
2 surgeries.
Surgeries and terrible complications and terrible trauma. And a lot of people would not have made it out alive.
No. And as a result of that, since this guy knew specifically that he had had such internal damage, he was suggesting the latest technique. "Oh, this is the best, not like the rest, robotic surgery." And then he pumped me with fear. "You got to do it. You got to do it quick." I said, "What are you talking about?" He said, "Look, if it metastasizes, right, it goes to another organ or bone. A guy like me might open you up and look at you, say, enjoy your next 6 months, maybe travel a little bit, but the Grim Reaper's going to take you away." I see, "You're kidding." "Oh, it could go that quick. It could go that quick."
Now, this is one of the most distinguished, experienced doctors doing robotic surgery in New York, right?
Yes.
And he was telling you with a low PSA, your PSA was 3 or 4, and your Gleason score, I think, was about 6, that you have to rush in and do it.
Got to do it right away.
You have to rush in and do it.
If you
right?
hesitate, you could be in a pine box, 6 feet under, pushing daisies. No warnings about the ramifications, but he's talking to me about, hey, I'm going to bring my whole team in here. He brings the anesthesiologists, the other surgeons, talks about how they work the robot. We'll go in there. You'll be in and out.
So he was pushing you to have emergency surgery.
Yes.
That you could die if you wait, right?
Yes.
Now, I remember you and I met. We met in my new facility over on Broadway and 38th Street. And you remember what I told you?
He said, don't do that.
And I said, what else?
Yeah, you said, look, you don't have to lose your prostate.
And I said something else. There's no emergency, if you remember.
No,
that.
you said, why? Why the panic? But you see, what happens is when your family members know, and the doctor has confided into them, and then everybody is like, oh, they're like wash women and wash guys, you gotta have it, you gotta have it. We're all dependent on you, gotta think about your kids, and so all of a sudden it starts building up, and then you realize, okay, I could survive without, look, I got shot 5 times, I survived, what is it? It's a little gland, right? I'm looking online, well, no biggie. Little did I realize that little gland controls so much of what a man does.
Before we get there, so you had someone like me telling you, Curtis, you can wait, you're not going to die of this cancer, you can have terrible complications from surgery.
Yes.
And on the other hand, all these other people, the surgeon telling you...
Surgeon?
6 months to live? Is that what he told you?
Yes, yes.
He told you have 6 months to live.
Could any moment, it could metastasize. I'll be opening you up, looking inside and saying, enjoy your next 6 months.
Why do you think he was pushing all the fear and panic buttons on you? Why?
Like anything, like quotas, he probably, look, he's almost in a penthouse kind of atmosphere. There are nurses, aides running around. He's got big bills. I'm sure he's got a nut hanging over his head that he's got to pay each and every month. And if he doesn't do surgeries, how is he going to generate that income?
Do you think he was pushing you just for that reason?
Oh, there's no doubt about it. And also because people knew who I was, figuring, hey, I've got somebody who is on the radio, is on TV, can become a proponent of robotic surgery the way I do it.
So he was using you feel, for financial reason, financial gain, and for gain of his practice.
Oh, yeah, to have a high-profile patient. Obviously, to be able to continue to do more surgeries, because then if you said, I did the surgery on Curtis Sliwa, that's a tough guy. Yeah, no. And that encouraged more people to be schmucks and putzes like me, like lemmings. We just follow the robotic surgery trail.
Now, speaking about those schmucks, and I think you also broadcast some of your radio during the actual surgery, right?
Yes.
So you were sucked in totally to this whole thing.
Well, I got to tell you, he told me, don't worry about it. We go in, we go out. You'll be able to be back on air over the weekend because it was a weekend surgery.
But were you broadcasting during the surgery?
Not during the surgery.
But immediately before and after?
Before and after. And I got to tell you, afterwards, I would have rather have been shot by those 5 bullets again. That knocked the hell out of me like I couldn't believe. All of a sudden, I'm hooked up. I've got a bag on my leg, and it's attached right into my penis, and I'm filling it up like there's no tomorrow. Every 5 seconds, and I'm tired, and for the next year, I felt like a schlub. I was just moving around.
Before we get to the year, let's talk about. So you had 2 experiences. You had this trauma with these 5 hollow shell bullets,
right,
and the recovery, and then you had radical prostatectomy, which 100,000 men go through a year.
Yep.
Can you compare those 2 operations and medical procedures and hospitalizations?
When you get shot, you want any kind of surgery to save your life. So you benefit from that. And then I had the reverse surgery. But I'll tell you this. Having gone through robotic surgery and the pain and strains afterwards and all the problems that I had that followed the surgery, I'd rather get shot again and go through that old-fashioned surgery where they go in with a scalpel because they have no other choice at that moment.
And what were you told before the surgery that the risks and benefits and alternatives would be? What should you expect after that surgery?
I was told that life would be a lot better. You won't have the fear of cancer. It'll never return. You won't have problems now. You won't have to worry that, the one negative thing is, when you're having sex, if you can have sex, because he didn't even mention that there would be a problem with that, there's no way that the woman can get pregnant. And at my age of 55, I already had 3 kids. I'm thinking, well, that's a benefit.
So you're in the money.
Right. I don't want to have another kid.
So you had the idea you could have all the sex you want.
I don't have to use a Jimmy Cab condom. I don't have to worry about prophylactics. He goes, that's the benefit of losing your prostate is you can't impregnate a woman. And we had a few belly laughs over that.
And when did the laughs stop and when did the tears start?
Almost as soon as the recovery process took place. The pain was excruciating.
So immediately after surgery?
Immediately when I wake up, I woke up in a very nice room, a lot different than a normal kind of hospital setting. But even that, with all that ambiance, the pumped-in music, feeling like you're in a 5-star top-shelf hotel, the pain and strain of just moving around. And then I realized, there's something wrong here. I think fugazi has been done to me on this, and a fugazi means you got shortchanged. You got sold wolf tickets.
When do you start feeling buyer's regret?
The moment I had to start using these pads. Now you see these pads that I have here.
And I still have them now.
2 a day, because you got to take them over. Look how big this is, right? Women think they have problems with pads. That time of the month. Look how big this is. And when this doesn't work, you got to put on a Depends diaper.
And you're still having problems. This is now 5+ years later.
Yeah, 2 a day.
Still to this day.
Yes.
So let's go back to the surgical. So you woke up from the surgery. You were in pain. You were unable to. You had a catheter in for a while.
Yeah, the catheter.
How long was the catheter in?
The catheter was in. I was having problems, so for about a good 2 months.
For 2 months, you had a catheter.
I had a catheter strapped right to my leg, and I was filling it up like there was no tomorrow.
And you had the catheter in because you couldn't urinate on your own.
No, could not urinate on my own.
He gave you some tests and to see if you could urinate on your own, and the tests showed you couldn't.
Right.
And so it took 2 months to get back to urinate somewhat on your own.
Right, but never the same again.
You were never able to control the urine fully like you were before.
No, you'd have urges, you go to the bathroom, have the urge to go, nothing happens, you pull your trousers up, and it's endless. You're back and forth. You wear out the carpet back and forth to the bathroom. Half the time you don't even get a drip. The other half the time you get a stream unexpectedly, and it's all over your pants. And now you feel embarrassed.
Now, what were you told about this before the surgery?
Little of anything.
Did he tell you anything that you'd be...
You might have a drip from time to time. What do you mean a drip? Well, it's like you take a handkerchief, you put some little paper in there. But after a while, it goes away. How many years? And I'm wearing this twice a day. How many years? Twice a day. A diaper.
Now, when you saw the surgeon back, you saw him many times after the surgery.
Yes.
And you expressed your concern.
Well, the first shock was, he goes, we're going to have to give you a PSA test. I said, Doc, a PSA test? I thought I'm cancer-free. You said, I'll never have to worry again. I could be like Gene Kelly, footloose and fancy-free. He goes, well, you never know. I said, you mean I'm going to have to keep taking a PSA test? Oh, yeah, at least once a year. At least once a year minimum. So right then I knew, that's a fugazi. Nobody ever told me that.
When he told you about surgery, did he tell you about the chance of failure, of surgical failure?
No, it was all positive. It was like Dr. Norman Vincent Peale, the power of positive thinking.
He never told you of a certain percent that the cancer comes back, that the surgery fails?
No.
He never told you at any point?
No. And in fact, he had charts, that talked about how robotic surgery was the best, not like the rest. And, it had the human factor still because it wasn't just a robot, because he was controlling it, he was in the room. Then I come to find out, when I'm getting operated on, he's doing maybe 2 or 3 other robotic surgeries at the same time, running from spot to spot.
When did you find out about that?
Oh, months afterwards.
So you, months afterwards, you found out that he was doing 2 patients or more at the same time.
3 patients!
At the same moment.
To meet the quota.
Did you ever confront him about that?
No, I was because I got pissed off at myself, doctor. I said to myself, look, I sat with you. You put me on the straight and narrow path. You had helped my dad years before that when you gave him a second opinion that saved his life. If he had gone with his primary health care provider, he'd have been dead and buried. So here I was, a Stu Knott, and I got embarrassed. I said to myself, I did this to myself, not realizing that I got sold a false bill of goods. And I'm sure there are a lot of guys out there who get sold a false bill of goods.
So you were blaming yourself for all the surgical complications?
Yes, absolutely.
About which you were told little or nothing?
No, and I figured I was an exception to the rule. Then I start meeting other men. And because we have this fraternity now, we know the language.
So you talk to many men who have had prostate surgery now.
Many men.
And what are their experiences? Is it more commonly like yours or not like
Well, the first thing they do is they lie to me. They come up and they say, "Oh, I had good surgery." I say, "You're lying, right?" I say, "I bet you're dripping, right? I bet you can't control your urinary flow." "Yeah, from time to time." I said, "It happens to me every day. I keep pointing out, I have to wear these diapers, these freaking diapers, like a little baby." Then they start to open up. And I said, "Yeah, what about when you have the urge to merge, right? You're hot to trot with a lady." "Oh, yeah, well, that becomes a problem." I said, "A problem? It's an ordeal." Because then you go, "Well, what do I do? Take Viagra, Cialis, and if it doesn't work, then what do I do if all of a sudden I'm impotent?" Because impotency is the result of surgery. I don't care what they tell you, like all of a sudden, you're going to be like Bionic Man. It doesn't happen.
Okay, so what did the surgeon tell you before the surgery about the chance of keeping your sexual
Oh,
function?
we got magic pills. It's the age of magic pills.
So magic pills, but did he tell you that the surgery was going to damage your sexual function?
No.
Never, ever before the surgery did he tell you you'd be impotent from the surgery?
Never a mention of impotency, because right away that would have been like Robbie Robot in Lost in Space. "Danger, Mr. Robinson, danger." You would have told me I'm going to be a eunuch and impotent. I would have said to you, "Hold on, let me go back to Dr. Lederman. He's got to have a better way than this."
So you were never told about cancer coming back?
Never.
You were never told about losing control of your urine?
Having to wear diapers every day, right?
You were never told about that?
No.
You were never told about impotence?
Right.
So what the heck were you told?
I was told that you are on the verge of having the Grim Reaper drag you into a grave. And it will metastasize. You don't understand, Curtis. This happens. I've seen so many patients. They delay, they vacillate. It's DID, the DID syndrome. Deny, ignore, delay doing anything. And then the next thing, they come to me when it's too late. I open them up. I look inside. Nothing I can do. I put them back together and tell them, enjoy your family for the next 6 months, if you have 6 months.
So you were never told with a PSA 3 or 4, Gleason 6, if you came to us, our success rate's 95%.
And remember, you have your primary health care provider, you have the oncologist, you have the robotic surgeon, right? All three of them are working on you. You got to do it. You got to do it. Now they're letting your family know, and your family, "Oh, come on, you're the provider here. We can't afford to lose you. We love you. Go ahead, do it." And then you've been told all the good things that can result, and you're thinking to yourself, "It's just a freaking gland. It's not my heart. It's not my liver. It's not my colon. It's my prostate." Let me tell you something. That prostate controls so much of what a man does, morning, noon, and night. When you're asleep, when you're awake, when you're walking, you're talking. I miss my prostate so much. I mean, without the prostate, I'm half the man that I used to be.
So you're angry about the surgery?
Oh, very angry. I'm very angry that I have to wear diapers, that I'm incontinent, that I'm impotent, that I have to use magic pills, and then I have to wait, the right moments, like maybe 45 minutes before, an hour before I want the urge to merge. This is nuts. I could have avoided all of this. How
do you deal with your anger?
I just really take it out by being on the radio and take it out on the callers and the listeners. And at times, I'm in a rage. You don't want to be around me, because when I all of a sudden flush out, and I'm unaware of that, and I'm looking down at my pants and it's wet, that's when I go absolutely ballistic. You don't want to be anywhere near my circumference. And it happens on a regular basis. And they never tell you that. And guys, don't let them bamboozle you, because you don't have to lose your prostate. You don't have to go through surgery. And let's face it, that's a surgeon. You go to a mechanic, right? The mechanic wants to work on the car. It's like going to a mechanic. Surgeon wants to take out your prostate, because that's what he does. He doesn't know how to do anything else. And when you look at their office, look at all their staff. They got to pay that nut at the end of each month. They've got bills, and you're going to pay that bill, because you're part of the quota that has to make that nut.
But we went to medical school to help people, right? And that's why I went to medical school. When I see many men with prostate cancer, I show them the results. I mean, there's studies from Harvard Medical School of robotic surgery patients, and it shows you 97% of the men who have prostate robotic surgery end up with sexual problems. Yep. 86% end up with urinary problems. We know what sexual problems are. We know what urinary problems are. The data's there, and he would have had to know that data. I mean, he deals with his patients every day. The patients can't hide it to him, So why does he, and why do the surgeons keep on operating when the complication rates are so
Because
high?
sucker patients like me keep buying this. They buy the mantra.
But how does he mentally do it? That he hurts men, their function, the rest of their life?
Oh, I'm sure in his mind he's so deluded himself. He's like it would be similar to being in a drug-induced psychosis where you have convinced yourself you've just saved Curtis's life. You've saved that person's life. At least they're alive. They're able to enjoy their grandchildren, their children. They're still able to work. You know, you're able to do the basic things. But all the other things that you were used to doing, forget about it. It's gone. Kiss it goodbye.
There are some surgeons in New York, some I deal with, who won't operate on men with prostate cancer. They send me their patients because they like our results. They see the patients I treat, they see the quality of life, the results of the prostate cancer treatment. They refuse to operate, and they're taking away their own income.
Yeah.
So there are some surgeons who say, look, I am not going to cut on men with prostate cancer.
Well, you would even think the last thing in the world you should do is cut. You should explore all other options first. Why wouldn't you want to have your prostate when it controls your ability to have sex, to be able to urinate properly? And it's just the feeling. You're so unsure. You know, you lose your self-esteem. That's really what you do. You lose your self-esteem in bed. You lose your self-esteem walking around because at any minute you got to go to the bathroom. Try to find a bathroom in New York City, right? Starbucks used to have bathrooms. They've started to close them. You got to get a cheeseburger and fries in order to be able to use the bathroom at the Greek Diner. Meantime, your Depends is dripping on the floor. And you say, Madonna, I can't believe this. I'm in my 60s. I'm not 90. And yet, I felt like a 90-year-old man.
I have a radio show, and sometimes people call me up. One man called me up recently. He said he had a Gleason 7 cancer, he had surgery, and I said, well, how did it go? And he said, it went great. And I said, well, what's your PSA now? He said, well, doc, the PSA is going up. And I said, well, how can you say the surgery was great if the PSA is going up? PSA going up means that the cancer is coming back after that surgery. He said, oh. And I said, well, how's your urinary control? He says, well, I leak urine. And I said, well, how can you say the surgery was great? You're leaking urine. He said, oh. And I said, what about erections? He said, well, there's been no more erections since the surgery. I said, mister, you said your surgery was great. Your cancer's coming back. Your sex life is gone. You're leaking urine. When you tell people that the surgery was great, you're misleading them. And we're on the radio. You're misleading thousands of people. And maybe he thinks I'm interrogating him, but I'm interrogating to get to the truth. And the truth is that the surgery was a total failure.
Well, you know, we men need a recovery group, all of those of us who've been butchered by robotic surgery, so that we could actually reveal to one another what it's really like, because we don't want to say that to anybody. We don't want to acknowledge to anybody that we're incontinent, we're impotent, and we want to believe that our doctor's the best, not like the rest, because everyone keeps feeding us the problem. Oh, that's the best. Oh, you went to who? Oh, he's like God. You know, he's the Mashiach when it comes to medicine. And then you realize it's all bull feathers. It's all bull feathers. So that's why men need to sit down who had robotic surgery and actually discuss with one another all the problems that they have, because only a man to another man who's had it can be real to one another.
Who's honest to other men.
Yeah, well, you have to be honest first, and that will elicit honesty from
Why
men.
are you so honest? Why are you so different than most men who've gone through the surgery and try to hide it?
Because I realize I don't want other men to go through this. I don't want them to go through what I go through every day, every week, and no, it is never going to get better, because you can't put that prostate back. This is the way my life is going to be. And as you age out, other problems are going to occur that are just going to make it that much more worse. And I know those days are coming. So I kick myself in the tuchus saying, boy, was I stupid. I should have gotten that second opinion from you like you gave to my father. You saved my daddy's life. But me, I'm pretentious. I'm a big asshole. I know everything, right? I knew nothing about nothing when it came to my prostate. If I'd have listened to you, I'd be no longer impotent and no longer incontinent.
If we're able to arrange a support group, would you be interested in running that?
Oh, absolutely. Absolutely. I'd be the
something?
first to tell my story, because you need someone to break the ice. You need somebody to open up a man's mind and let them acknowledge the mistake that they made. And now, okay, Now, what can you do? You got to repair your mind because you got to live with this the rest of your life. And what happens is they become very nebbishy, slubby. They lose their self-esteem. And in fact, if anything, they sit on the couch, they drink beer, and they get fatter because they figure like, that's it. That's what my life is going to be. It's like a dog who's been snipped. You know what happens to a dog? They lose their aggressiveness. They lose that spark. It's almost like the testosterone has been drained out of your body. Yeah. I am half the man that I used to be because I lost my prostate.
Any final words for listeners who have prostate cancer or confronting it?
Well, number one, you got to go to Dr. Gil Lederman because he's not part of the old boys network. He doesn't believe in surgery, chemo. All the rest of the doctors are in their fraternity, their sorority. It's back slapping, handshaking, and they do referrals. And you think, oh, my doctor's the best. Don't listen to Uncle Vinny or Aunt Sally because if you actually look at the track record of how many people have gone to that doctor, see how many of them are still alive, inhaling and exhaling every day, and how many are dead. Don't be a schmuck like I was. See Dr. Gil Lederman, and you'll always be fair and square with him. You'll always set the plate in terms of what their options are, and you'll follow through. You'll be with them through thick and thin.
Thank you so much.
Oh, it's the least I can say, because you got to avoid what I went through, by all means. And ladies out there, if you're watching, talk to your men who are all nervous, the moment, prostate, don't let them lose their prostate, because it doesn't only impact your man's life, it's going to impact your life, because he's not going to be able to perform. No, he's no longer going to be a stallion, that's for sure. He's going to be a eunuch. You don't want that.
Thank you so much.